For the choice of the Netherlands to work together with the government of Uganda in sexual reproductive health and rights. Well, one reason is that in line with all the international agreements, we feel it's really important that everyone should be able to make safe and informed decisions about their reproductive and sexual health, and also in an environment that is free of violence.
One of the key areas that the Heroes Project focuses on is strengthening health systems, and really to ensure that health systems work for young people, enable young people to access youth-friendly services, with an aim to empower young people to realize their SRHR in gender equal societies.
We have seen a number of people who have been reached with knowledge and information on sexual reproductive health. And as I speak, as of end of December, we had reached about more than 400,000 people in the region through the different curriculum, the age-based curriculum that we implement in the various areas. And we believe that we have contributed. The Heroes program has had a big contribution in this area.
The man who pregnanted me told me that I'm going to pay for you school fees. Then by the time he found me on the way, he just grabbed me and raped me. And this time he's not around. I don't know where he went.
Children who were admitted in P1, that cohort, as they progress, by the time they reach P5, first of all, in P1, girls are more than boys in most of the schools. But as they come to a transition class of P5, girls are disappearing at a very high rate. By P6, they are almost not there. In P7, girls are very few. So they poach them when they are still young, and some of them, they come back by 17, they are now, they are marrying off 14, 15 years.
We have one challenge of high teenage pregnancies in the sub-county. So we do a lot of things about family planning, things to do with the communication, behavior changes to the community, but we still have this enemy with us, that the teenage pregnancy is high. So we do wish that we find another alternative to fighting this high teenage pregnancies in the community.
Buhemba sub-county has got a number of challenges in terms of sexual gender-based violence cases and the related cases to sexual gender violence. We had a number of issues before the Heroes came to Buhemba, because we had very many cases were reported, home quarrels, school dropouts, defilement cases, teenage pregnancies, early marriages. We had so many cases in that line.
One thing we have learned so far is that having young people leading this whole process of referring fellow young people with a digital voucher and moreover empowering them beyond really the services has proven to enable young people to heal completely and overcome SGBV. We have also realized that the collaboration and the integration as partners leads to even more impactful outcomes for young people and moreover lasting outcomes.
Heroes for Gender Transformation have enlarged our minds as younger people. It found us when we are a bit far, deep in the village. But as I talk now, at least I have got one gift from one parent where the children transformed from the life where he was staying. At least by now, he's in good life. Bba wange yabeera n'obusungu n'angamba ndi nze sigenda okuwaanira omwana ono n'essente zonna. Sirina ssente. Nze somesa abaana bagala okusoma. Sisomesa abo bagenda mu kunoonya abalenzi. Nimugamba nedda tukole mpola mpola nga Dennis atubuulidde tumaze okukwata byatugambye n'atandikira awo ne tutandika okuyamba Leah n'asoma n'akola ebibuuzo n'ayita mu bulungi.
I just want to continue learning up to my dream in future. I wanted to be a prisoner as God wishes.
Defilement yalinganingi mu biseera ebyo ng'ekitongole kikaali kwidda. Ekitongole ekyaidda baaba nga tukola tujja mu byalo twategeka emikuŋŋaano twabasomesa twabalaga defilement case ngambi. Saade buti abaana baba tumanerina nti abaana ba heroes tetugeme ku baana ba bene ba heroes. Defilement cases onakutwafuna ng'olwisi nga 5 mukaaga asade no tutandise ofuna ku mu wiki nga 2 olwisi lulala.
We need now to have interventions that target the schools designed to enable learners to stay in schools longer. If interventions are geared there, it's directly going to influence the health indicators such that we minimize on the teenage pregnancies and many other risk factors.
Heroes program came with some of the concepts which we have not actually having as a district. Like, for example, having the creating SGBV advisory center at local governments. For example, the one in Wahemba, that one has helped in the referral pathway. We appreciate that we have the local councils, we have the local leaders down there, but with even this SGBV referral, the advisory center at the sub-county, it has helped us so much in that we as government, also Namaingo district local government, we have also picked from what Heroes has been doing, and we have scaled up to other sub-counties.
Nze kitongole kino wekyayidira omusaada yali yanzira aye nga tidde engema yaki ya musaada ngambisa musaada amaiso butiye bajanga batusomesa saawa eno ndi bulungi era natuka n'olondebwa n'abanga ndi wano mu office namba bakazi banange era esanu lyendi nali ebitirivu nze nakyusibwa obwongo n'amanika ku kyalo n'amanika ino ku lw'ekitongole kino era ne ba parish daifedire neighbor ndimu kuna abaana batya babiri aba environment aye baba mpa basomere wange era ndi nabo bawala bona kuba bali batyo somera ku masomero agewe ibweyo kale twabange ensomesa gye tusomesaamu batwesiga saawe eno twakyusibwa obwongo.
Most of our services, I would say they were not to standard, but working with the Heroes program, we have managed or we have improved in our service deliveries from minimum standard to at least a required standard, both by the government and to the level of World Health Organization.
In technical quality, we have done a lot. The key one was issues of human resource. Realized that we did not have enough numbers to respond to the demand that we were mobilizing people to come for services. And one of the things that we achieved was to work out with these colleagues of ours, and we had to to begin, first of all, redistribute human resource, the available human resource, that we now staff people according to need, not according to the staffing norm. So, like one of the facilities that is directly under project implementation, Mulombi Health Center 2, we had to post there a medical clinic officer. We posted there midwives to ensure that we now responded to the demand. But those staff are not on the structure as per the staffing norm.
We see resource mobilizations, prioritization of resources now. Adolescents are being considered in that area. So through all this, it has been on the effort of the program advisory team.
As much as we have made a lot of positive contributions, there are still a number of challenges that we need to address. And one of them, of course, we feel that we are not yet there in reducing the teenage pregnancies. So we need more effort in this area. And one is that one of the driving factors is still the poverty levels in the communities that we work with. So we need to have approaches that will handle and have some empowerment of the communities that we work with to be able to overcome some of those challenges that they face, and therefore contribute to reduction in teenage pregnancies. Because when we interact with some of the young mothers, that is a key thing that they bring out as a contributing factor to the stagnant, I could say stagnant teenage pregnancies in some of the areas that we work with.
So we have champions, but male engagement in these other programs is still low. We need to find an intervention, or heroes to help us find an intervention of mitigating or bring men on board, so that we can strengthen or have these health interventions addressed.
And we are very impressed with what we've seen. We've visited all the different components of the program, from the health to the education to the community structures. We had very engaging discussions at district level, but also at sub-county level. And we see a lot of best practices, and we see also a lot of opportunities for the program to even scale, or maybe to be scaled, hopefully, by the district. We are very, very happy with the collaboration that the HEROES team has been creating, actually, with district and sub-county government, actually from the local level, local council 1, totally up to the district, which has ensured a real ownership by the district, but also by the community groups of the program. There is that really strong connection and collaboration, and that was very beautiful to see, and that really gives hope for the future and for sustainability of the program after the HEROES program has been finalized.
It is the first project to promote adolescent health in the district, and it is the first project to embrace school health within the district. So we are really appreciative as a district.
I would like to appreciate all the consortium partners that are implementing the HEROES program. And in conclusion, I want to send special thanks to the donor, our donor, the Embassy of the Kingdom of Netherlands. We are very grateful for the funding that has enabled the implementation of the HEROES program in the East Central Cluster.